Insect bite reactions. Definition. Insect bites, stings, and infestations produce local inflammatory reactions in response to injected foreign chemicals and proteins. Acute skin reactions appear as hives or papular urticaria, and more chronic reactions appear as inflammatory papules. Insects that sting, usually when threatened, include bees, wasps, and fire ants. Insects that bite, usually out of hunger, include mosquitoes, fleas, flies, bedbugs, and lice. Spiders, ticks, and chiggers are other arthropods that sometimes attack human skin. Insect bites. Grouped red, crusted papules with red flare. History. When someone is stung by an insect, the insult is usually remembered because the sting induces immediate pain. This is not always the case for biting insects. Some delay may occur between the actual bite and the itching that follows. If the physical examination suggests insect bites, even when the patient is unaware of having been bitten, the history should be pursued carefully for possible exposures. For indoor exposure, fleas are common offenders. We inquire not only about pets currently living in the dwelling but also about whether pets recently occupied the premises. If a house had been previously occupied by flea-infested pets, the abandoned hungry fleas may form a welcoming party for the newly arrived human guests. We also ask about pets in homes visited by the patient. Spiders are sometimes responsible for indoor bites. Their presence requires a careful search of the home. Bedbugs are becoming an increasingly recognized household insect that likes to bite in groups of 3, commonly referred to as breakfast, lunch, and dinner. A. Bedbug insect bites, characteristic, breakfast, lunch, and dinner. B. Recovered bedbug, Cimex lenticularis. Bedbugs often infest bats and birds and then hide in cracks and crevices, attacking the susceptible, sleeping victim in the early morning hours. Infestations with head lice often occur epidemically in school children, so a history of affected playmates should be sought and the school nurse consulted. Contrary to some misconceptions, it is not necessary for other persons dwelling in the same household, or even the same bed, to be affected. For insect bite reactions, 2 factors are required: a biting insect and a host who is allergic to the bite. Not all people are sensitive, and not all people attract insects equally. Indoor insects include fleas, spiders, bedbugs, and lice. Note, papules and, in highly allergic individuals, bully occur only in people who are allergic and who attract the insects. Physical examination. The reaction to a sting is usually an immediate hive, often with a central punctum, that resolves within a few hours. The lesions are present in localized distribution. Large local reactions, manifesting as extensive erythema and swelling at the bite site, resolve after several days. Of the stinging insects, only the honeybee leaves behind its stinger, which on close inspection appears as a sharp barb projecting from the skin. If found, this stinger should be removed gently to prevent the release of additional venom from the attached venom sac. Fire ants produce multiple itching hives, which quickly progress to painful papulovesicles and pustules. The bite of a recluse spider is unique in that it produces a severe local necrotic reaction with ulceration. Brown recluse spider bite, impending necrotic skin reaction. Although the bite may be quiet, the reaction that ensues over the following days is not. Chiggers favor the legs and areas of tight-fitting clothing where they produce inflammatory papules and vesicles, and occasionally even bully. Ticks painlessly burrow their heads in the skin, and pubic lice, pediculosis pubis, attached to hair, both can be visualized macroscopically. Head lice, pediculosis capitis, may be difficult to find but should be suspected in the presence of itching of the scalp, particularly the occiput or peripheral scalp. Insect bites, multiple vesicles.
Lice, multiple vesicles, excoriated papules and white nits in hair. The eggs, nits, are most often found and appear as small, 2 to 3 mm, oval, translucent concretions affixed to hair shafts. Similar findings occur in body lice, pediculosis corporis, and pubic lice, crabs, pediculosis pubis. Physicians are most often consulted for insect bites that produce itching papules. These are typically grouped and asymmetric. Flea bites frequently occur in streaks of 3, breakfast, lunch, and dinner. Sometimes, a central punctum can be identified in the papule. This is diagnostic. If the offending insects remain in the environment, new lesions will continue to appear. Occasionally, only excoriations are found. Post-inflammatory hyperpigmentation after insect bite reactions is commonly seen in patients with skin of color. Differential diagnosis. For patients with urticarial reactions, other causes of urticaria may be considered. When the hive has a central punctum, its cause is an insect bite. Other foreign bodies can induce pruritic papules in the skin. Fiberglass is an example. This diagnosis can be suggested by the history and confirmed by the presence of a refractal material in the epidermis on biopsy or skin scraping. Delusional infestation, aka delusions of parasitosis, is a severe, chronic medical condition characterized by crusted papules and scars from skin picking. Patients suffer from a false, fixed belief that bugs are under my skin and cannot be corrected by logic or reasoning. Diagnosis and treatment require building rapport and psychiatric evaluation and treatment. Delusional parasitosis, multiple crusted papules and scars from chronic picking. Dermatitis herpetiformis is in the differential diagnosis, particularly when only excoriations are found. Excoriation may also lead to secondary infection and a diagnosis of impetigo. An uncommon idiopathic disorder, pityriasis lichenoides, presents with scattered necrotic papules and vesicles that can resemble insect bites but are usually more generalized and symmetric. A skin biopsy helps to distinguish pityriasis lichenoides disease from an insect bite reaction.
Differential diagnosis of insect bites. Urticaria. Delusional infestation. Dermatitis herpetiformis. Pityriasis lichenoides. Laboratory and biopsy. The diagnosis is usually made clinically. Skin testing with commercial venom kits can be performed by an allergist. A biopsy, if performed, shows a wedge-shaped superficial and deep cellular infiltrate so dense that it may be mistaken for malignant lymphoma. An insect bite is suggested by virtue of a mixed inflammatory cell infiltrate, which includes numerous eosinophils. Insect bite reaction. Epidermis, crust, spongiosis, inflammation cell infiltrate. Dermis, dense infiltrate of mixed inflammatory cells, often including eosinophils. Therapy. The primary therapy is to remove the offending insect from the environment of the patient or vice versa. Insects that are attached to the skin can be gently removed with tweezers, e.g., ticks, or killed chemically, e.g., lice, with agents such as permethrin creme rinse, nix. For lice, fomite transmission is proven, as adult lice can live away from a human host for 3 days and nits can live for 10 days. Most lice treatments are pediculocidal, but not ovicidal, and require a retreatment in 7 to 10 days. For fleas, not only must the pet be treated but also the house must be professionally fumigated. Insect repellent containing diethyltoluamide, DEET, remains a safe and effective deterrent to insect bites, especially ticks, with the lowest effective dose of approximately 30%. Permethrin application to clothing also repels ticks, agents responsible for Lyme disease and Rocky Mountain spotted fever. Colognes, perfumes, and scented hairsprays can attract insects and should be avoided in sensitive individuals. Treatment of the inflammatory reaction in the skin is symptomatic. Topical steroids, systemic antihistamines, and occasionally systemic steroids may be helpful in relieving the itching. Therapy for insect bite reactions. Initial. Separation of host from insect. Lice, topical permethrin. Fleas, house fumigation. Bedbugs, house fumigation. Ticks, DEET repellent and permethrin on clothing. Symptomatic therapy for itching. Topical steroids, e.g., clobetasol 0.05% cream BID for 2 weeks. Antihistamines. Alternative. Lice, topical benzyl alcohol and malathion. Symptomatic therapy for itching, systemic steroids. EpiPen for highly allergic individuals. Course and complications. In highly sensitive individuals, stings can produce serious anaphylactic reactions, mediated through immunoglobulin E, that occasionally result in death. Patients with anaphylactic reactions require prompt therapy with airway management, epinephrine, antihistamines, and systemic steroids, despite little evidence of systemic steroid benefit. Patients with severe reactions are likely to have severe reactions to future stings. Subsequent desensitization immunotherapy is frequently indicated for future prophylaxis. Immunotherapy is not necessary, however, in most children with urticarial reactions, even when these reactions are severe and generalized, as long as symptoms are confined to the skin. It is advisable, however, for such patients to have injectable epinephrine, Anakit, EpiPen, readily available, especially when picnicking, hiking, or camping. Most insect bite reactions resolve spontaneously and uneventfully. Secondary infection may occur, particularly when the patient has been scratching excessively. Scratching and infection can lead to scarring. A persistent local reaction to the bite of an infected deer tick is a characteristic finding in Lyme disease and is called erythema migrans. Pathogenesis. Most insect bite reactions are the result of host allergies to injected secretions, including venoms, from stinging insects, and enzymes. Histamine, acetylcholine, and other vasoactive chemicals have also been isolated from the venom of stinging insects, and these, too, may play a role in the immediate reaction. However, the primary mechanism for insect bite reactions is allergy. The degree of host allergy determines the intensity of the reaction, which ranges from none to severe. As exemplified by erythema migrans, cutaneous reactions to insect bites may also be caused by microorganisms transmitted by the bite.
Thank you for your attention.